was your doctor's appointment today?
It wasn't that good.
Well, what'd you find out?
Well, I found out that I've been diagnosed with asthma.
No way. I have asthma too.
You do?
Yeah.
Well, when you were first diagnosed, did you find that you were asking your doctor a lot of questions?
I had a ton of questions.
So did I. The first question that I asked my doctor was, what is asthma?
Well, what did he tell you?
He told me that the medical definition of asthma is simple, but the condition itself is quite complex.
Yeah, my doctor defined asthma as a chronic inflammatory disease of the airway, causing a variety of symptoms such as tightness of the chest, shortness of breath, wheezing, and coughing.
These symptoms can be brought on by a variety of triggers, such as animal dander and perfume.
In someone with normal lung function, air is inhaled through the nose and through the mouth. It passes through the trachea before moving into the bronchi, which lead away from the trachea. The bronchi branch into smaller tubes called bronchioles, ending in many small sacs called alveoli. It's in these alveoli that oxygen is passed into the blood while carbon dioxide is removed from it.
When someone with asthma has asthma symptoms, it means that the flow of air is obstructed as it passes in and out of the lungs. This happens because the lining of the airways becomes inflamed, producing more mucus. The muscles that surround the airways may become sensitive and start to twitch and tighten, causing the airway to narrow. This usually occurs if inflammation is not treated and directly contributes to the homeostatic imbalance within the body due to a lack of oxygen. The common denominator underlying all forms of asthma is an exaggerated immune response to a variety of stimuli. Airway inflammation is manifested by the presence of eosinophils, lymphocytes, mast cells, and destruction of the bronchial epithelium.
So, when an antigen invades the body, plasma cells produce large amounts of class IgE antibodies against the allergen. IgE antibodies then attach to mast cells in body tissues and to circulating basophils. More of the same antigen invades the body. Antigens then combine with IgE attached to mast cells, which trigger degranulation and release of histamine. Histamine will cause blood vessels to dilate and become leaky, which stimulates secretion of large amounts of mucus and contraction of smooth muscle, and asthma may ensue.
When the allergen is inhaled, symptoms of asthma appear because the smooth muscle in the bronchioles contract, constricting small passages, which directly constricts airflow.
Cytokines, a protein, also have an important role in the inflammatory response. Tumor necrosis factor alpha and interleukins 4 and 5 mediate asthma symptoms and response through their effects on the bronchial epithelial and smooth muscle cells. Tumor necrosis factor alpha is stored in and released from mast cells and plays a critical role in the initiation and amplification of airway inflammation.
When talking about the diagnosis of asthma, the first thing that your physician will do is ask for a complete family history and include questions that target any asthma symptoms that you may be experiencing.
Your doctor will also conduct a physical exam and listen to your breathing.
During this initial appointment, you may also undergo some diagnostic tests such as a lung function test. This can be known as a spirometer.
As for treatment, people with asthma take two types of medication, which are known as preventers and relievers.
Preventers, such as Advair, control the symptoms of day-to-day asthma. They should be taken every day. Relievers, such as Ventolin, should be taken at the time of an asthmatic attack for immediate relief.
So here's a summary of asthma. Asthma is a chronic inflammatory disease which can cause various symptoms.
It's caused by an exaggerated hypersensitivity response to a variety of stimuli.
It's diagnosed with a physical exam, family history, and lung function test.
They are treated with two types of medication: controllers, also known as preventers, and relievers.